Varieties of cough. Dry cough, common in pleural disorders or interstitial lung disease, where there's irritation but no mucus production. Productive cough, this cough produces sputum, which can indicate infections like chronic bronchitis, pulmonary tuberculosis, or even lung abscess. Brassy cough, characterized by a metallic sound, often due to pressure on the trachea from tumors or other space-occupying lesions. Bovine cough, a non-explosive cough that lacks force, sometimes seen in patients with tumors pressing on the recurrent laryngeal nerve. Paroxysmal cough, this is a prolonged, repetitive cough seen in conditions like whooping cough. Barking cough, resembling the sound of a seal, often associated with epiglottal inflammation or psychological factors. These different sounds and characteristics provide crucial hints about the cause of this symptom.